Now we're going to move into some statistics regarding youth mental health. We're going to be reviewing national, state, and local Mecklenburg County and CMS statistics. So what are we talking about here? So we gave you the definition of mental health, but we now want to move into mental disorders among children. And these are described as serious changes in the way children typically learn, behave, or handle their emotions, which causes distress and problems getting through the day. And we know we see quite a bit of this sometimes in CMS. So we're going to start with national statistics. And when we go through these, I want you to see how we compare in North Carolina to the national statistics, and then how we compare in Mecklenburg County to the North Carolina statistics and to the national statistics. So one of the first things we want to talk about is ADHD, behavior problems, anxiety, and depression. These are the most commonly diagnosed mental health disorders in children. 9.4% of children aged 12 to 17 years have received an ADHD diagnosis. So that's about 6 million in the country. 7.4% of the children ages 3 to 17 years have a diagnosed behavior problem. Again, 4.5 million. A little bit less, 7.1, ages 3 to 17 have a diagnosed condition of anxiety. And then 3.2% of the children aged 3 to 17 have diagnosed depression. So sometimes we see conditions occurring together. For example, having another disorder is most common in children with depression. So about 3 in 4 children aged 3 to 17 with depression also have anxiety. And then almost 1 in 2 have behavior problems. So that's quite a large number. So you can see that depression and anxiety can go hand in hand, and we call that comorbidity. For children ages 3 to 17 years with anxiety, more than 1 in 3 also have behavior problems, and about 1 in 3 also have depression. So when you think about that, you can see that if students have anxiety or depression, then it can manifest into behavior problems in the schools, where we would see that. And then children ages 3 to 17 with behavior problems, more than 1 in 3 also have anxiety, and 1 in 5 have depression. So again, you see a lot of these things kind of going hand in hand with each other. And that's how we see when we see some of the behavior problems that manifest in the schools, it has this underlying cause of either anxiety or depression. And when we think about how things have increased over time, really depression and anxiety, we're seeing a higher number of kids being diagnosed. So those kids that ever have been diagnosed with either anxiety or depression among children ages 6 to 17 increased from 5.4% in 2003 to 8% in 2007, 8.4% in 2011-12. And then the increase of diagnosis of anxiety ever being diagnosed increased from 5.5 to 6.4% in just about 5 years. Depression in the same time frame of the studies from the CDC did not change. And then also we have a lot of different treatment rates that vary among different mental disorders. And it's not just for mental disorders, but it's also where kids live. And we're going to talk about that when we get to the North Carolina statistics a little bit. But nearly 8 in 10 children aged 3 to 17 with depression receive treatment. So that's really actually really good. That's a great number. But only 6 in 10 children with anxiety receive treatment. So we kind of want to figure out, why are kids getting more treatment for depression than anxiety, and quite a bit more. And then if you look at this last statistic, only about half of those with just behavior disorders receive treatment. And again, a lot of those behavior disorders would have some other comorbid, but these are really great statistics we want to look at, because, why aren't these kids really getting any treatment? So to finish up on some of the national statistics, we also want to look at mental, behavioral, and development disorders really begin early in childhood. 1 in 6 U.S. children ages 2 to 8 had a diagnosed mental behavior or development disorder. Again, I'm going to repeat that. 17% of our kiddos in the nation ages 2 to 8 have a diagnosed mental behavior or developmental disorder. And the rates of mental health disorders will change with age. Usually the diagnosis of depression and anxiety are more common as you get a little bit older, and then the behavior problems are more common among children aged 6 to 11. So now moving into North Carolina, let's look at some North Carolina statistics, and then again, think about how these coalesce with those national statistics we took look at. So this first diagram, I want you guys to see our youth ranking in North Carolina. If you look at this, these bright yellow, kind of mustardy yellow, are going to be the highest ranked when I go into the statistics on the next 2 pages. And we're kind of in this muddy green, which you can see we're just below the highest rank in North Carolina. And I'm going to show you these statistics. And you can see these blue are the lowest. And so these are the states that have better statistics. But again, we're just below that, that mustard yellow with the highest rank. So basically what this was looking at, we're looking at the states that ranked 39 to 51, and that would indicate that youth have higher prevalence of mental illness in that state and then lower rates of access to care. North Carolina is ranked 45. So there's only the 5 states plus I think Puerto Rico that are, for lack of better words, worse than North Carolina. And we're going to go through the different measures that made up this ranking on the next few pages on how we rated in North Carolina based on all of these things with the 7 measures. So the first measure is talking about depressive major episode. So 12% of the youth in North Carolina, ages 12 to 17, reported suffering from at least one major depressive episode in the past year. Then the next measure was talking about other things that are comorbid. So 9.8% kids cope with severe major depression, and depression in youth often co-occurs with other disorders like substance abuse, anxiety, and disorderly behavior. 3.6% of the youth in North Carolina reported having a substance use disorder in the past year, which is quite high. And this one, we were actually ranked worse in North Carolina. 74% of our youth with major depression didn't receive any mental health treatment. So that really was a little bit different than the national statistics. They were, I think, at about 50%. So more of our kids that have major depression are not receiving any treatment at all. Then about 22% of the youth in North Carolina with severe depression have received some consistent treatment. So that's actually a fairly good, but when you look at that, we really want the other one to increase. And then we also want to look at this rating also talked about which kids didn't have mental health coverage, and 10% of our kids don't have mental health coverage. So that could play into a part about why some of the kids aren't getting any treatment. So now we're going to move into Mecklenburg County and CMS. So when we look at North Carolina and across the state, what we're thinking about in North Carolina, in Mecklenburg County, is we use the Youth Risk Behavior Survey. This survey is done every 2 years, and our last survey was done in 2019, but it did take until January of this year to get all of that data back. So we're going to go through some of that data that ranked middle school and high school students in Mecklenburg County. So overall, the rates that students feel good about themselves dropped 8 percentage points for middle school and high school in 2 years. So that's quite a dramatic drop. Males were more likely than females to report that they feel good about themselves. So 81% of the males versus 52% of the females in middle school, and then 71% versus 53% of the females in high school. So that's quite alarming that we have that big of a gap with how many more females are not reporting that they feel good about themselves. And in middle school, multiracial females and Hispanic females were the least likely to report feeling good about themselves. So these are things that we also want to take into account when we're working with our students. And then in high school, our Hispanic females were least likely to report feeling good about themselves, again at 43%. So some more data from the Youth Risk Behavior Survey. We want to also look at the overall rates of feeling so sad or hopeless almost every day for 2 more weeks that they actually stopped doing usual activities at least once in the past year. And that increased 7% in middle school and high school students over the 2 years since we did the Youth Risk Behavior Survey. So 7% more kids are stopped doing activities because they feel so sad or hopeless. And because when we think about that, it's really being sad or hopeless is potentially a symptom of depression, we see that females had higher rates of persistent sadness compared to the males. So 39% versus 26% in males in middle school. And then look at the high school rate, 47% of the females versus 28% of the males in high school had more of persistent sadness. And again, this is definitely a symptom of depression. And among both middle school and high school students, multiracial families had the highest incidence of persistent sadness. Again, another data point we really need to be aware of. So now we're going to go into suicidality in Mecklenburg County, and then we're going to compare this to just CMS data as well, because it's really important to look at these numbers compared to what we've done here in CMS. So 25% of middle school students reported seriously considering suicide in this 2019. And again, remember, this is pre-pandemic data. So it's going to be really interesting to see when we get the post-pandemic data. And then about 20% of high school students reported considering suicide in the past 12 months. And that was up 3 percentage points from the 2 years before. So think about those numbers. 25% of the middle school students and 20% of high school students reported considering suicide. And then if you look at the next dramatic data point, 18% of middle school students and 18% of high school students reported making a plan about how they would attempt suicide. And that's up 2 and 3% respectively from 2 years before. And then this one is just shocking to me. 13% of both middle school and high school students reported attempting suicide. And that again was up 1% for middle school and 3%. So these numbers are really high. And again, I want you to think about these numbers when we go into when we talk about our suicide assessments in CMS, because we have a lot higher number of kids considering it, making a plan, and attempting than we have identified in CMS. So here's our totals for CMS. And I went back and wanted you to see several years because I wanted you to see the pre-pandemic years. Because when we do suicide assessments in the schools, we have 4 different categories that they can be have by risk level. That's no expressed, low, moderate, and high. And as you can see, with the first part of the pandemic year of 2020 into this year of 2020 and 2021, our totals of assessments dramatically dropped. We did have a lot more students being assessed outside of CMS than we probably have in the past, because we have done a lot of mobile crisis visits and well checks, which I'm going to show you here in a second. But as you can see, our majority of our numbers are low. But if you look at how many high risk assessments we have throughout these years, these are the ones that have an immediate response that day to be seen by a mental health professional. So again, this past school year, we had 1,058 suicide risk assessments. So if you think back, about 25% of our kids are thinking about that. And in middle school and high school, we have about 75,000 students. We're missing a lot of kids. We're missing a lot of kids. I also wanted you to see in CMS our SUA assessment totals by grade. Again, through the years, this is just this past school year, but this is pretty much what our data looks like for as long as we've been keeping data. Our highest number of suicide assessments tend to be those middle grade years. But again, look at the numbers we did in high school and think again and go and reflect back to those numbers we just talked about and how many high school students are thinking about and making a plan for suicide. So we are missing quite a few students here. And just another breakdown, we do have more females that we do assessments on in CMS, and that goes along with the state data and the national data, that we do more risk assessments on females than males. And I did want to mention too, we did do a lot of well checks through the police department, but we also utilized our mobile crisis through the year. And you can see the data here during school hours. This school year, we didn't get updated data for the end of the school year, but we probably had about 350 calls during the day. But you can see on non-COVID years, we do utilize mobile crisis for mental health support for our kiddos quite a bit. And after school hours and weekends, the numbers that times that parents and other agencies are calling for support. So we do utilize our mobile crisis for our mental health, kids with our mental health distress. So I did want to also mention that we do have school-based mental health in the majority of our schools in CMS. We don't have all of the data for this school year, but last school year we did make 3,322 referrals to school-based mental health, and we actually had 1,448 that had intakes where they received support. And then this year we had 1,000 referrals, but we don't have all of the data yet to show with exactly which ones that we had for actually did intakes. But we also do referrals outside of just school-based mental health. So we do have a lot of other kids that are receiving resources outside of CMS, plus our school psychologists, school social workers, and school counselors provides mental health support for our students as well. So that wraps up just some national, state, and local statistics for you. And we're going to move you into just a discussion on which of these statistics really surprised you and why.